Okay, so let's talk about something that can be pretty scary. You're pregnant, everything's going along, and then you feel this sharp, one-sided pain. It just hits you out of nowhere, and of course, your mind starts racing. But here's the thing I want you to hear first. Most of the time, this is actually a totally normal, even if it's uncomfortable, part of your body making room for that baby. You know exactly the feeling I'm talking about, right? You're just rolling over in bed, or you stand up from the couch, maybe you just cough, and bam, this really sharp, specific pain that just makes you freeze. And it's so unsettling because it feels like it's in one exact spot. And yeah, this quote pretty much nails it. That's the immediate thought. Wait a second, is this okay? And that's a completely normal, understandable reaction. But what you're feeling is also incredibly common. So the key isn't to panic, it's to understand what your body is actually trying to tell you. So that's our goal here today. We're going to break down why this happens, and more importantly, help you learn how to recognize the patterns. This is all about giving you the confidence to know when it's just your body stretching and you can rest, and when it might be a good idea to check in with your doctor or midwife. All right, let's get into the why. Why is this happening? To do that, we just need a super quick, really simple anatomy lesson. I promise it's not complicated, and it's going to make that sharp pain make a whole lot more sense. So the number one most common reason for this one-sided jab is something called round ligament pain. Think of it like this. Your uterus is held in place by these thick, strong bands of tissue, kind of like support cables on a bridge. As your baby and uterus grow, those cables have to stretch, and sometimes they just get pulled a little too fast. Okay, so here's how it all goes down. Before pregnancy, those ligaments are just kind of hanging out pretty relaxed. But as your uterus grows week by week, they get pulled tighter and tighter. Now, that slow, gradual stretch might just feel like a dull ache. But when you make a sudden move, like standing up quickly or even just laughing hard, it yanks on one of those already tight ligaments. And that's what causes that sharp, sudden, stabbing feeling. It's a fast stretch, and it's almost always kicked off by movement. Now, round ligament pain isn't the only possibility, of course. Your body is doing so much work. You could have a simple muscle strain because your center of gravity is changing, or it could just be trapped gas or constipation as everything inside gets a little more crowded. Early in pregnancy, the tissues around your ovaries stretch, and later on, the baby might just be snuggled up on one side, putting some extra pressure there. See the common thread. These things are usually related to your position, and they tend to come and go. And that brings us to what is, honestly, the most important part of this whole explainer. I want you to try to stop focusing so much on the exact location of the pain, and instead shift your focus to its behavior. Seriously, how the pain acts over time is a much, much better clue than where you feel it. So from now on, I want you to think like a detective. When you feel that pain, instead of immediately jumping to worry, just get curious for a second. Ask yourself, okay, what was I just doing? Does it feel better now that I've stopped moving? Is it getting worse, or did it just, poof, disappear? Watching for the pattern, that is your superpower here. And this right here really breaks it down perfectly. On the left, you've got those normal patterns we've been talking about. The pain is triggered by movement, it comes and goes, feels like a quick little jab, and it eases up when you rest. But I really want you to pay attention to the column on the right. These are the patterns that should get your attention. Pain that happens even when you're totally still, pain that is constant or feels like it's getting worse, or pain that shows up with other symptoms, well, that's a different story. And that is the key distinction we need to make. And remember, the goal here isn't for you to diagnose yourself. You don't need to become a medical expert. Your only job is to be a really good observer of your own body. Because when you can describe these patterns clearly, you give your doctor or midwife incredibly helpful information to figure out exactly what's going on. Okay, so let's build on that. Let's get into the action plan. Now that you know what to look for, let's get crystal clear on the specific signs that mean it's time to pick up the phone and get checked out. Think of this as your go-to checklist. You should definitely call your provider if the pain is persistent, it just won't let up, or if it feels like it's getting progressively worse. A big one is pain that's happening even when you're resting. Also look out for anything that comes along with the pain. So if it's paired with a fever, nausea, vomiting, or chills, that's a reason to call. Same goes for dizziness or just feeling generally unwell. And this next one is very specific. If you have sharp pain in your upper right abdomen, especially after a fatty meal, you need to check in. And finally, any abdominal pain that's accompanied by a headache or any changes in your vision is a sign to call right away. These are the patterns that fall outside the range of normal. And please, please take this to heart. Your medical team, they are there for you. Reaching out with a concern isn't being needy. It's being a proactive partner in your own health and your baby's health. It gives you peace of mind, and you cannot put a price on that. So trust your gut. If something feels off to you, it is always okay to ask. So if there's one single thing you take away from all of this, let it be this. Notice the pattern, not just the pain. Shift your focus from the feeling itself to the story that feeling is telling you. Is it a quick, movement-related jab, or is it something more persistent? Answering that question is what matters most. And that really leaves us with a final thought to chew on. This whole idea of observing patterns, it goes way beyond just pregnancy pain, right? When we learn to listen to our body's subtle cues and behaviors instead of just reacting when the loud alarms go off, we become so much more informed and empowered on our own health. So how can you apply that to your own journey starting today?